which is creating havoc in Bharat, which is India, at this time. Again, the goal of this video is purely for educational purpose. It is not intended to replace a professional medical opinion. If you need help on your specific case, consult your local doctor or get some telemedicine consultation. Use this video as for an informational purpose or educational purpose, so you can understand what to look for and what to expect going forwards. Again, with that disclaimer, let us start. Okay, so this is Mukar mycosis fungal ball growth in the nose. It is like a fungal ball that has grown in the nose, one of the sides of the nose attached to the septum of the nose. And why it has grown like that, and what you should do if you have any symptoms and how you prevent, we will go over in this video. So before we go into further, let's go to CDC website. Okay, so I'm just going to highlight here. This is Mucormycosis, which we are talking about, which is a fungal infection, and it obviously is not that uncommon, especially if you're immunocompromised, but certainly it's very uncommon if you're immunocompetent. So, and small outbreaks do happen in certain group of people who are immunocompromised, such as organ transplant patients. Just to understand what it is a fungal infection, and it comes because of the spores that are present all over. They are present in the soil, sometimes they are in the air as well. They are, whenever there is a decaying substance, like a decaying organic matter, then these fungal spores are present ubiquitously there. So if you see here, leaves, compost piles, rotten wood, so decaying organic matter. So all of this has these spores, and these spores germinate if you're immunosuppressed, and then they invade and they grow ubiquitously. And if they grow into your sinuses and thus invade into your eyes and to your brain, it is called rhinocerebral mucormycosis, which can be fatal. There is another one called pulmonary mucormycosis, where this fungal ball grows in the lungs itself. And then you have gastrointestinal, which is less common, cutaneous, less common, and disseminated. Especially if you have significant immunosuppression, the fungus can be all over the body, including the blood, and it is often fatal unless aggressively treated. So the key one we are looking at here is this rhinocerebral mucormycosis and pulmonary mucormycosis. So just to give you an idea again, rhinocerebral and pulmonary mucormycosis we are talking about. Rhinocerebral here, pulmonary here, okay? That's what we are looking at. And I will go into second one. This is, I think I showed you the fungal ball already, which is this one. However, I think there is some delay in the video, so that's a the fungus can grow anywhere. Obviously, it can grow in the lungs or sinuses, and in the X-rays, you can potentially identify. In the X-rays, you can potentially identify on the chest X-rays or CT scans, but unfortunately, you cannot 100% diagnose that way. So you really have to get a specimen and look it under the microscope. And when you look it under microscope, you will see this hyphae, which is essentially this fungal structures, stick-like structures. This is nothing but fungus, and there are spores. When they germinate, they form hyphae, and they keep proliferating and forming the fungal ball. So going back here, so what is mucormycosis we already understood, And second, what are the symptoms? The symptoms depend on what type of mucormycosis you have. So if you have rhinocerebral, which is the sinus and brain, you get headache, facial swelling, nasal congestion, and lesions in the nose, which are black mole-like lesions in the nose, and fever. And if you have pulmonary mucormycosis, you get fever, cough, shortness of breath, chest pain, and those kind of things. Of course, if you have disseminated, which is all over the body, including the blood, you have varieties of symptoms, and you are pretty sick. And again, disseminated mucormycosis has a high mortality. Overall, mucormycosis, especially if there is invasion into the blood or brain, it can have high mortality. Those are symptoms. And how do you prevent? Obviously, keeping the immune system good is a key. The spores are there everywhere. So you may be inhaling spores all throughout your life, but it did not affect you because your immune system is good. And when you are taking steroids, when you're already sick because of COVID-19, and somebody gave you a high dose steroid for a long period of time, then your sugars are going up. If you have a pre-existing diabetes that is known or unknown, or you may be borderline diabetic, which you may not be often aware of, then somebody gives you high-dose steroids. This combination of high sugars plus high-dose steroids, which causes immunosuppression, plus this infection with COVID-19 going on, these three together is creating havoc. If you have these three, you have very high risk of developing mucormycosis because the spores are there everywhere. Of course, if you wear mask, you may inhale less number of spores. That is always worthwhile. But if you're short of breath, you may not be wearing mask. And if you're going everywhere, then the spores are there. Wherever there is a moisture, the mold is growing and decaying organic matter. Mold is growing, and often they can get into the air, and you may end up inhaling it. So where it comes from, I think we just talked about. It is there everywhere. So I would just basically say, just assume it is there everywhere. The diagnosis is made by taking a specimen from wherever this fungal ball is there and then looking under the microscope. When you look under microscope, this is what you see. So you see a fungal ball, and obviously from here you take a piece of tissue, and then from here you take a piece of tissue which is from the nose, and then you end up taking this specimen looking like this. Again, very, very important that this is diagnosed correctly and on time. This is another picture of the hyphae with the spore. Going back. So that's how you diagnose it. And the treatment of mucormycosis. The treatment is improving the immunity, reducing the exposure, hydration, conservative measures, debridement, wherever the fungus ball is growing, remove it, and of course giving antifungals like amphotericin B and other antifungals. Obviously, the antifungals, when we give into the IV, they may not have adequate penetration into the place where the fungal ball is growing. So debridement, that is the surgical removal of the fungal ball, is a key, and there is no other shortcut otherwise. And I would also say, I will also show you some pictures that show you how it invades. So this invaded the sinus, maxillary sinus, which is somewhere here. So as you can see, this is a sinus, and from sinus the fungus ball is growing here, all over here. It is growing here, and from there it is growing here, and then it is invading through the nasal plate. It's invading the eyes, and then it can go into the brain and can cause fatalities. So that's one. And second I want to show you is sometimes it is just a swelling, you will see. And as a patient, of course, here he has a ptosis probably due to fungal invasion, but not 100% sure about it. And the key is obviously, here another one, a picture of mucormycosis, invasion into the eye. The fungus has invaded into the eye, and here invaded into the eye. So they need debridement, and they may even lose eye. from surgery. So it's a key. Key is to prevent as much as possible. Okay, so that's how it is treated, and we will go back into again the important thing, that is creating problems. I'll just put this in a simple way so that you understand. Three things are happening here. One, COVID-19 infection. Second, blood sugar going up. Third, immunity going down due to steroids. So if you have COVID-19 infection and if you are given high dose steroid by your doctor, make sure you check your sugars and keep it below 200. Okay, that's our target, below 200. If you keep your blood sugars below 200 by using insulin or any other medication, or by using the steroids at a smaller dose for the shortest period possible, your risk of mucormycosis goes down. So if you have these three together at the same time for an adequate period of time, high sugar, large dose of steroid causing immunosuppression, particularly cell-mediated immunity, and COVID-19 infection, which probably already suppressed your immune defenses. If you have these three, you have a very high likelihood of developing mucormycosis. So out of these three, avoid steroids as much as possible, unless it is absolutely necessary. And if it is necessary, use the smallest dose for a shortest period of time. And during the use of steroid, check your blood glucose and keep it below 200. That's the key. Okay, so if you do those things, then your risk will significantly go down. But certainly you need to be vigilant of any signs of infection. And if you do develop infection, then make sure you contact your doctor as early as possible. Again, this is Dr. Tumala. I'm a neurologist from Frisco, Texas. Thank you for listening and watching this video. If you like this video, please subscribe to our channel, forward, share this video to your friends and family so that they can also get benefit from this video. And most importantly, click that bell icon so that you can get updates as soon as we post new videos. We will be posting videos related to general health and any specific topics. Again, good luck to everyone. Dhanyavad.